And let's hit record. I forgot to hit it before. Okay. What's up, everybody? Welcome to the Soft Tissue Practice Revolution, the podcast, where my mission is to help practitioners that specialize in soft tissue treatment how to significantly increase their skill set, their business, scale their practice, make more money, all while being ethical and not ripping off patients. My name is Dr. Matt Maggio, and I am the founder of the Soft Tissue Practice Revolution. And welcome to episode 8. So on episode 8, those of you that are watching on YouTube, you can see behind me is the importance of knowing an actual diagnosis. So I've been all over the place in these first couple episodes, giving my story, giving some ideas on business, going back and forth. So we're going to have a hodgepodge of what's going on. We'll have some technical things, we'll have some business things, we'll have some sales things, and we'll even just have bigger perspective and overall system type of things. So once again, I always appreciate anyone that's taking time to listen to these and give me their time and their energy, because I know that's your greatest resource. And one thing that I just wanted to put out there too is these are in the early stages, and I'm very open to feedback. I'm also very open to anything that people have for ideas or things they want to share, or even if they want to give me some critique. I'm open to all that. This is all new to me, getting my ideas out there. I spent the last 8 years of my life just getting all this system down and creating what's called the peak method and getting it all in place. And one thing that I realized was I needed to document this and get this out there to help other people, because when it all said and done, we need better doctors, we need better systems, we need better practices in order to help put an end to this pain pill epidemic that killed my father. I talked about that on earlier episodes, and that's my real driver and that's my real motivation. So in today's episode, I want to talk about the importance of knowing an actual diagnosis. So we all know that as doctors and in school and in training, we just suck at diagnosis. Everyone sucks at diagnosis. We're always trying to appease the insurance company and fitting into this box. It's okay, well, here's the 8 things that we cover for insurance. You have to make that diagnosis work, which is complete nonsense the way the system's going on that. And I won't even get into all that, but it's we default as doctors as well. We get so simplistic with what we do. Let's get a quick sip of coffee here. So we're so simplistic with what we do because it's we want to dumb shit down. And it just doesn't work. The standard go-to for chiropractic is subluxation. Your bone's out of place and it's interfering with your nervous system, blah, 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 blah. I already talked about that. What does that even tell us? It doesn't tell us anything. Then you go into the orthopedic model and they throw the itis on stuff. Bursitis, tendinitis, and then things like that. And then in the physical therapy model, it's well, you got impingement and you got, what else do they got? They got syndromes, patella tracking syndrome, or things are weak, things are tight, things aren't firing. It's what isn't firing? What tissue isn't firing? Why in the fuck isn't it firing? Why are things not working? What bursitis of the hip? What the fuck does that even mean? People come in all the time and they're yeah, I got diagnosed with bursitis of my hip. Oh, great. Well, your surgeon's a fucking genius and just basically said you have swelling of the hip. So nobody does this. Nobody asks the question of, why do you have these things? Why do you have swelling? Why are your muscles weak? Why are things tight? Why is your bone subluxated? They don't know, because everyone goes into this idea of treating with, I call it blinders on. And they've even shown this in studies. It's people only diagnose based off what they're trained in, instead of what's actually going on in front of the patient. Like I said before, chiropractors say bone's out of place and things aren't moving properly. Physical therapists say tight and weak. Orthos say bursitis, tendinitis, things like that. But it doesn't tell us anything. You need a tissue-specific diagnosis of what's going on. It's what are there? There isn't a lot of things that can go wrong with the body. It's a very narrowed list. But you have to know. One thing could just be an actual tissue problem. What's wrong with that tissue? Is it degenerated? Is it have scar tissue in there? Is it actually functionally weak? Is it atrophied? Lots of things. Is a nerve stuck to it? Is a muscle not functioning correctly? All these questions, but we just dumb it down as doctors, and then we just throw some treatment at it and see. We hope and pray, and we go, all right, let's see what's going to happen. And then we wait. And we go, okay. And then we think the patient's better. And then we come in and we go, hey, Sally, how do you feel? And they're well, I think I feel better. How the fuck do you know if they feel better? You need to have a functional approach and a functional system to get in there and figure out exactly what's going on. And if you're starting with these, I call them junk box diagnosis of like, hey, it's this, it's tight, it's weak, your glutes are weak, we got to get them to fire. Instead, be a doctor. Use your goddamn brain and think. Be like, why the fuck are those glutes not firing correctly? But we go to this very simplistic and reductionist approach. We go, oh, the glutes aren't firing, so let's get them to fire again. And it's like, no, you dumb fuck. What's going on is they're not firing for a reason. You could have an underlying problem. You could have a disc injury in there. You could have a lot of other problems in there. So we always just like, let's turn some stuff on. Oh, well, this muscle's tight, so let's stretch it and let's move it. Why is that muscle tight? Why isn't it moving? Why isn't it stretching? There's an underlying problem in there. And we are the worst as doctors of completely disregarding pathology. And pathology, what do I mean, is like tears, disc injuries, all that. There's a whole faction of, I call them basically just dumb fucks out there that are like, oh, completely ignore pathology. Like, you're not your MRI. Well, come on. Like, no, it isn't the whole picture. Trust me. It isn't like what the orthos do where they're just like, hey, this is torn in here, let's go get it fixed. But it's not the other end either. It's not just like, oh, completely disregard it, do whatever you want. Like, that doesn't matter. What you have to understand as a doctor is people come in your office for a reason because they're in pain. And ignoring pathology is crazy. Like when they go and you see these studies, they're like, well, 85% of the population has disc bulges and, you know, they're asymptomatic. Well, yeah, those are people that aren't in pain. But if a person comes into your practice and they're having low back pain and they have a disc bulge or a herniation, you have to consider that that could be a problem. And you can't disregard it. But what happens is we try to get into this reductionist approach, and the insurance companies have totally fucked us anyway. They've given us such a narrow scope of what you can diagnose and what you can do. But you need to know exactly what's going on in the tissue, in the load of what the patient's doing. Do they have high stress? Is their diet shit? Do they sit on their ass all day? Do they do all these things? Because people aren't getting better. They're getting worse because we're not being doctors anymore. We're not able to interpret data. We're not able to figure out exactly what's going on and get a true diagnosis for the injury. For the diagnosis to be correct, you have to have a tissue-specific diagnosis. And simply saying words like bursitis, tendonitis, tracking syndrome, glutes not firing, weak and inhibited, whatever, neuromuscular, all this kind of stuff, it's like, no! You have to use your brain and figure it out and take a functional approach to that. So I got a little ranty here, but it's like, just be better as a doctor. Like study stuff, learn stuff. And it's like, we're so technique based and we want a quick fix just like a patient. We want to go take this one weekend seminar and we're going to learn everything. We're going to go back and show all these fancy dog and pony tricks. And then you got all these Instagram fucks out there that are like teaching people how to fix their injuries. It's like, because this is weak or this isn't working right or something isn't firing. And I've had battles with those people before and I'm like, what if somebody has a underlying problem and they watch your video that's like, hey, how to get your glutes to loosen up and fire in 5 minutes with this exercise. But they have a disc injury that hasn't been diagnosed. Now they feel better, they go move, and then they go out and deadlift their ass off and they blow their disc out. There's some personal responsibility that you have to take there. So giving generic advice and generic diagnosis is not going to work. So this podcast today was more technique-based and ideas, but I'm really trying to build up some momentum of where we go and helping people diagnose better and figure out problems better too. And it comes with actually collecting data and listening to the patient. What happens is we go in there and we take a history on a patient and we're like trying to be like, just doing the checkbox, like blah, 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 the things we learned in school and make sure they don't have cancer, make sure they don't have this. But we're really just thinking, when can I put my technique or my treatment in there? And you totally miss a lot of information. So listen as a doctor, be better. So that's it for today's episode. Once again, I thank you for taking the time to listen. Your attention and giving me that energy is so great, and I appreciate that. And I said on past episodes, like, this is new for me, and I'm open for feedback, criticism, everything like that. But if you like what you see and you want to be part of the soft tissue practice revolution, what you need to do is click the link either on YouTube if you're watching, or the bio in the podcast link. And that's going to take you to our Facebook page and give you requests to become part of our Facebook group. You got to answer a couple questions as you come in, and we'll approve you if you are, and then you'll get access to even more of this information, everything that we like, what we're sharing, everything like that. We're going to help you be better at business, be better at sales, be better at life, be a better doctor, because at the end of the day, I want to help doctors become better versions of themselves, especially ones that do soft tissue, so they can show up better for the patients, have the life and practice that they deserve, and they can help people avoid bigger problems like pain pills down the road. So thanks for listening to the episode, and we'll see you guys on the next one.